Hi everyone, in this video we will be going over a blood loss estimation and our postpartum hemorrhage kits. First things first, I am going to have you estimate how much blood loss a patient has had. This will be pad number 1. Pad number 2. Just completely saturated. Chuck's pad number 1. And Chuck's pad number 2, which is also completely saturated. Show you them again. Pad number 1. Pad number 2, completely saturated. And Chuck's pad number 1. And Chuck's pad number 2, completely saturated. Please take a moment and write your guesses down and we will weigh them to see the accurate weight. Pad number 1, we will weigh it. In order to weigh it, we zero out the scale. That is 195 grams or 195 cc's of blood loss. Pad number 2, which is completely saturated. Is 295 grams or cc's of blood loss. Chuck's pad number 1. Is 480 cc's or grams of blood loss. And then a fully saturated Chuck's pad. Usually is 1,000 grams, but as you can see, this is fully saturated. And it comes out to 720 grams or cc's of blood loss. During a postpartum hemorrhage, we do not, unless absolutely possible, we do not want you guessing the weight of the blood loss. We want you to weigh every single pad, every single Chuck's pad. Sometimes the mom might have an ice pack, or she might have bled onto a sheet. We want the correct blood loss. So, some things to know when you are running a postpartum hemorrhage. If a mom is bleeding, the first step that you want to do is press the staff assist button. You may get a call from your secretary or from your chargers asking if you need any assistance, and you would have everybody come in. As the primary nurse, you will be the person to stay by the patient's side at all times. Once someone else comes in to help, make sure that you delegate. You'll have someone be the runner who can get a Dynamap if there's not one already in here. We also have a postpartum hemorrhage kit, which contains our IV starts, our blood draws, a bag of LR, and sterile gloves for the doctor, a gown, IV tubing, and so forth. In the Omnicell, we also have another postpartum hemorrhage kit which gets all of our medications out. You will pop up with Cytotec, Hemabate, Methergin, Pitocin, and a bag of Pitocin. The only thing that you will have to pull out of the stocked meds is the Dilaudid. For the Cytotec, they come in packs of 200 micrograms, so you would grab 5, which would equal 1,000 micrograms for a dose. You also want to send someone to grab a scale from the nursery. Our postpartum hemorrhage kit is located where the Omni cell is, which is in our utility room. In order to get in touch with the resident, you would page them at 55333, stating that the patient is having a postpartum hemorrhage, put the patient's name and the room number, with any information that you can give them, whether it's vitals or the amount of blood loss at that moment. If a resident does not get back to you within 5 minutes, feel free to call them at 22008. If someone doesn't answer that phone, it bumps up to the second-year resident and then to the third-year resident, and someone should respond. What you do with the Dynamap is go ahead and put it on the patient and get the pulse ox as well. You would start it and cycle it for every 5 minutes. The next step would be to try to get an IV access if a patient doesn't have it, and then go ahead and run the fluids wide open on the pump, or if there's not a pump in here right away, you can hang it on the bed pole. Again, there's another bag of LR in the box if the patient isn't already running on fluids. While you're waiting for help, you should be massaging the patient's fundus to help contract the uterus. Once the resident comes up to assess the patient, they may tell you to give the drugs. Cytotec cannot be given by a nurse. It is given rectally. It has to be given by the resident. Methergin and Hemabate always have to be given IM. They are in glass vials, and there are also filter needles found in the postpartum hemorrhage kit. You also have a vial of Pitocin or a bag of Pitocin. If a patient doesn't have IV access in time, you can go ahead and give the Pitocin IM. The Dilaudid is going to pop up. You should be able to override it, and you will be told to give one dose of the Dilaudid, either IM or through the IV access before the doctor does the manual exam. The second portion of the video will show a postpartum hemorrhage simulation.